Hank, thanks for that wonderful introduction. I appreciate that. It's great to be with you. And it's great to talk about healthcare in Michigan. It is critically important. I'm very proud of all the other things we've done, but I'm proud of what we're doing in healthcare. And it's interesting, when you become governor, you have to learn the key metrics: cost, quality, and access. See, I got that down right at the start in terms of what we need to work on. A few things I wanted to mention, though, in terms of talking about not just the programs we have, but the strategy that we have with respect to healthcare at the state level. First of all, tomorrow we have a big day. It's April Fool's Day. Everybody thinks of it that way, but April 1st is the birthday of Healthy Michigan. Tomorrow we turn 1 year old. And to give you an idea of size of the program, after 8 months, we passed our 2-year projection in terms of enrollment in the program. And Hank mentioned 500,000. Believe it or not, the number is actually 603,000. And still climbing. I'm proud to say it's a program that's really working well. And it's not just how many people we have enrolled in the program, it's the fact the program's working and people are using the program. To give you a couple other numbers that I think are really relevant, in terms of preventive care visits, the number now exceeds 450,000. So the people are using the program to get preventive care and hopefully avoid that ER visit or that chronic condition that might be prevented by getting health care sooner and better in terms of the process. In terms of mammograms, the number's over 34,000. In terms of so many different procedures, we're seeing great things happen because of this program. And so I'm very excited by what's going on, and we're going to continue on this path. A number of other things, though, are good. One of the other programs we've really expanded that I've been diligent about since entering office is actually on the dental side, Healthy Kids Dental. We're over 500,000 kids now, and we're working on a path to get all of Michigan covered over the next few years, to have every young person in Michigan have the opportunity to be part of Healthy Kids Dental or a traditional dental program. So that's really exciting in terms of things. In terms of big other things that you may have questions, I know you have Nick and Chris later. I'm sure you'll get into the detail on some of those. Is actually we're going out to rebid our health care plans for Medicaid. And that's a big issue and a topic on many people's minds in this room. So I'm sure you can ask me, but you're going to get probably better answers out of them in terms of the details of that, but it's very exciting. Another huge area in terms of showing value and innovation is dual enrollees. That we've launched our program now. We've got a major pilot going in the state of Michigan that just launched this month in terms of dual enrollment, because that's a huge opportunity to manage our cost structures. Another area that too often gets overlooked is mental health. Again, Healthy Michigan helps with mental health, but many things we're doing is we just had a mental health commission this last year, and we're going to continue to work hard on the greater integration of physical and mental health as an area that we need to work on. I think there's much greater opportunity to do good work there. So if you step back and look at what we're trying to do is look at a holistic approach. How do we really help our citizens, our customers, be more successful? It ties back to getting a job, but it's also a fundamental thing about how healthy someone is. What I would say, though, is we need to keep it in the context. It's just not about what government does. We need people to take better care of themselves. And that's a big element if you go back and look at Healthy Michigan, where we really tried to distinguish it from traditional Medicaid. We need people to be involved in their health care. The most efficient health care we have is wellness and personal responsibility. And we need to engage people more in that process. And Healthy Michigan is doing that. We're seeing a large number of people, literally well over 100,000 now doing health risk assessments, other procedures, and they're actually coming back with ideas about how they want to improve their health. And that needs to be integrated in this whole process. So it's part of this collective to make things work well together. When you look at it and you look at healthcare, though, we do have challenges coming up. To be open with you, we've got a Supreme Court case that's going to raise certain issues. We'll have to wait to see how that turns out. To be open with you, we had the Affordable Care Act. And I put it in context. I view it as probably one of the most polarizing things we've had happen in our country in a long time. You tended to find people either being dramatically for it, dramatically against it, and very seldom actually looking at the facts in terms of what it did and what it didn't do. One of the things we've tried to do is stick to what are the facts and break it down and find opportunities where we think we can really help people and areas where it doesn't fully address what needs to happen in the future. The Affordable Care Act is not our long-term solution. I still believe we need fundamental health care reform in our country going forward that talks about the cost structures, again, continuing to push the medical home model, other things that need to happen, looking towards a long-term future in this area. It's something, though, when you talk about healthcare, the area I wanted to sort of pull together for you in Michigan that we're doing right now in many respects is the river of opportunity concept. And it's really about helping people get successful so they can be in the mainstream of opportunity, so they can be self-sufficient, they can have a good life. And that's really one of the big moves we're making now with the reorganization of Department of Community Health and the Department of Human Services. When I announced the executive order, people defaulted the traditional way and perception of what happens when you do a reorganization. They say you're just moving departments around. You're reorganizing the deck chairs. This had nothing to do with reorganizing the deck chairs. This is stepping back to say there's a better way for government, for the public sector to look at serving our citizens in a more holistic way. And it needs to happen. It's long overdue. And what do I mean by that? And again, this is really about the integration of healthcare in terms of human services, employment services, all these different areas, bringing it back together to focus on an individual basis. The role of government really changed back in the 1930s. And I'll do this quickly. I'm not going to take you year by year from the 1930s up. But government started becoming involved in people's lives in the 1930s with the Depression. And it was merited. We needed to do something. And some critical programs were developed back then. That was the starting point, but how did we address issues after that? And we had many issues from 1930 over the last 80 years that needed to be addressed. Well, the tradition has become one of every time you find a new problem, what do? You start a new prescriptive program to solve that problem. So over the last 80 years, what we've done now is develop well over 150 to 200 different prescriptive programs in government to say, how do we solve some segment of some person's life? And to be blunt, when you accumulate something for 80 years, it gets tired, it gets worn, it gets heavy in terms of the overhead, the administrative costs, and it sort of loses the focus on what really matters, the person. So what we've done now is create an environment where instead of treating people as people, in many cases they sort of lose some of the dignity of being a person because they end up becoming not just one case with one program, but they end up in multiple programs in multiple cases to a bunch of different caseworkers in some cases. That's not right. We need to step back and say, it's not about programs, it's about people. And focus in on the people. Quite often when you look at these programs, what they're doing are about symptoms, not root causes. Again, if you think about that, we're dealing with a symptom. That's not a solution. We need to get to the root causes of the issues. And then when you look at the programs, how do we measure them? Well, first of all, most government doesn't measure their programs very well. I'm a metrics guy, you know that. So we've got lots of metrics to measure them, but traditionally the feedback I'd get is we measure how many people are a case, how many people are in the program. We don't do very well at measuring how often we've helped them be successful and leave the program. Isn't that what we should be measuring? Again, get them in the mainstream of the river of success, of opportunity. So we need to do metrics to measure success, not dependency. And the last point is, it's not just about government. It's about the community coming together. It's about all of us working together, whether you're a non-for-profit, whether you're a for-profit. We all have a common interest in having us do better and about bringing us to better for holistic solutions. And so that's really the concept of the River of Opportunity. That was the point of creating the Department of Health and Human Services. It might surprise you, that was the point of creating the Talent and Economic Development Department that I did earlier, where I merged 2 or 3 departments together there. It was the same principle, whether it be economic or human service. It's how do we come back to treat people as people, focus in on root causes, focus in on measuring success, and focus in on having us operate as a community. Now, the interesting part of this big, broad philosophy to say how do we better service humans and people that way, the best analogy I'll give you is the medical home model. That's what many of you have been trying to do for many years. It's not about going to 5 specialists. It's not about just dealing with one chronic condition. You're trying to treat people as real people again, saying what are all those conditions, what are all those issues, and how do you coordinate care to be successful? So all we're doing is essentially the same thing on a much different scope and scale. But philosophically, it makes sense. And so that's where I'm excited to look at the direction of where we're heading in the future in the state of Michigan. And you're going to continue to see this. As I said, we're doing well with Healthy Michigan. We have issues. We're going to go get a waiver, hopefully, to keep moving that program forward and continue to look at more personal responsibility and wellness in that program. We're going to continue to grow Healthy Kids Dental in a positive way. We're going to look at how we integrate human health, physical health, and mental health together and bring those things together in a constructive fashion. These are all good things, but we also want to integrate how do we bring healthcare to the local school? How do we bring it to the neighborhood? How do we get it closer to the customer, to the patient in need? Those are all the kinds of opportunities that are out there exciting. And then to the degree we get all that working well, we can decide how we want to engage in the national dialogue. Because that is something that Michigan could play a larger role in, about where we go next. Again, and try to do it in a way that's not as polarizing as the last round. But say, how can we be constructive and say, it's not about politics, it's about problem solving. Because that's where we've been successful in Michigan. We identify problems and we solve problems. So I'm excited to be with you here today. And so with that, I'm going to wrap it up and see what kind of questions you have on your mind. But I want to thank you for what you're doing for healthcare in Michigan. I know we have a very diverse group here. You have many different aspects you're involved with. But the key thing is we work together as Michiganders, recognizing in the end, we likely have a common customer. Whether it's first level, you may have an employer, you may have an insurer, you may have someone else as that first level customer, but ultimately it's the citizens of Michigan. The best answer we can all get is to have each of us as people, as individuals, be as healthy as possible, and to get the best quality of care as quickly as possible. So let's just do it together. Thank you.
All right, as Ed mentioned earlier, we'll take questions for the governor. If you have a question, please let me know. I'll call on you. Please identify who you are and the organization you're with. Questions?
I know the audience has some. The press has a lot on other topics.
On the way back there.
Very interested in your combining the Department of Social Services and Department of Community Health. How do you envision reaching out to the private sector of payers and health plans and large physician organizations and trying to bridge some of the social determinants of health that we see are root causes of a lot of things that cause the healthcare system unnecessary costs?
Yeah, well, this is where we can work together, and a lot of it comes down to information sharing. And again, you have to respect privacy with HICA and everything, but in terms of the public health issues, in many respects, there's a lot of innovation going on, but how do we identify what you might be doing uniquely through programs you're serving versus what we're doing? And how do we get the best practice in comparing those notes? And so that's something I really want to focus in on is how do you have events like this to bring people together? One way we're doing that is we're not just starting statewide, we're actually looking regionally. We have 10 regions in the state. We call them the 10 prosperity regions. And we're really encouraging a lot of economic development, but also social service development, a lot of work in these 10 regions for them to identify best practices, because we actually want to encourage entrepreneurship and innovation within the public sector and the private sector. Now, there's a novel idea in the public sector. But we can do much more to bring these ideas and bring them together. Because the more we collaborate, cooperate, share information, and what's best practice, the faster we can accelerate those. And it's also this whole concept of how do we integrate services between various groups. So another case would be like we're doing with Pathways Potential. We're putting caseworkers in local elementary schools or local schools to help provide better services. We'd love to find ways to partner with different organizations that also would have an interest in potentially being present in that school. Those are different opportunities that I think we need to be much more open-minded of, because if we can make that school stronger, that local community school, you're going to strengthen the whole neighborhood and we all win from that, whether it be public, private, whoever can do the best job in that school. Let's figure out how to optimize that, make it the busiest place possible, and win together.
Other questions for the governor? Governor, I have one. In shaping the state's initiatives on health care, have you used or looked at any other states as far as benchmarks or models for Michigan?
Yeah, we always try to look at other states. And again, there's a lot of innovation, particularly when we were looking at the waiver system for Healthy Michigan. Another number of states had tried different ideas. And so what I'd say is We respect what others did, but I like the flavor we came up with. So it's how you do the best hybrid that you think works for your state. And I think as a state, we're a great model because we're about as diverse as you get. A lot of times we need to be prouder of our diversity in this state. Michigan, whether it's the urban-rural issues or all the different variables you can find in the state, we're about a good cross-section for the whole nation in many ways, and we should be proud of that.
Other questions? Yes, sir. Wait for the microphone. Just again, identify yourself for us, please. Thanks.
Good morning. My name is Jerry Conal. I'm the health practice leader for Mercer. We're largest consultant firm in the United States. I'd like to piggyback on your question specific to ACOs. And we have a practice that evaluates the efficacy and growth of ACOs around the country. And my colleagues tell me Michigan is really lagging other states. And you talked about benchmark like Texas, Arizona, very strong. Michigan is lagging. Any idea on how we can sort of drum further interest in sustainable ACOs in Michigan?
Yeah, I think you're going to see interest in that pick up. And I think that's something that, in particular, the two gentlemen, you can get after them the next one. But I think you're seeing more initiatives and efforts to do that in terms of Michigan. And I think you may have other speakers later today that are innovating in some of those areas in ACOs in Michigan. So again, that's one of the things where you watch other states, and states are the laboratory of democracy. That's where a lot of the most interesting things are going on. So again, that's one of the things I hope to view here is many of you are out-of-state entities or multi-state entities. If you see other things we should be doing, let us know.
Thank you very much. Heidi Savage, National Manager of Benefits for Norma Group, automotive supplier. My question for you is two parts. What are you hearing as you tour around the states from employers, both large and small? What are their biggest concerns from the large employers and from the small employers as far as healthcare reform? And can you address the main things you're doing and you're addressing in the near short term from a state perspective for those employers? Thank you.
Yeah, well, the big issue you typically hear is the cost question. Again, how to manage the cost structures, about how to stay competitive, because we're in a global economy. And again, if you want to have a lot of great people working for you, you need to be competitive in your marketplace. So the large employer, in particular, its cost, again, they typically have more resources to do things in terms of wellness programs, again, looking at different national organizations they can bring in to help. The greatest challenge is at the small business side. And that's one of the great challenges of the Affordable Care Act. And it's a really scary thing if you're a small business person. Literally, you have to potentially have to make some really tough decisions about how you're working with your employees, what's the outcome, are you going to be competitive? Are you going to be able to stay in business? Or are you going to have to stop offering benefits to people that are like family to you? So the hardest piece is for small business typically, particularly if you're really small, you can figure out an answer. If you're in that middle range, that's where it gets the most difficult. And so a lot of time still needs to be spent figuring out the best answer with our small business people. It's a real challenge to strike that right balance because they really do care about their employees. At the same time, they have to make sure they're staying viable so they can keep those employees they treat like family still working there. And healthcare cost is one of the greatest problems they have.
Over here.
Good morning. I applaud your efforts and all the work you've done to actually go forward with expanded Medicaid in Michigan. I'm Randy Willinas with Metro Health Foundation, and I can tell you it has a huge impact, especially in southeastern Michigan, on people that were uninsured. One question though, what's your thoughts on sharing information as far as who's insured, who's uninsured by geographic area? Also, other data like money I know is flowing to health plans, but who's really getting service from that? And then finally, like the all claims database that would allow, again, your data focus, how do we use this information within the communities to actually advance health?
No, I appreciate that. That's a really simple question. Because there's several aspects. It's a balancing act. Because on the face of it, two things I'm always kind of advocate, and then you have to say what are the caveats that can make it more challenging. One is just general transparency in terms of making information available is a good thing. as a generalization. The other one is measurements and having good data, because that's how you can make informed decisions. So generally, in terms of the direction you're heading, I'm very much to do that, very much in favor of that. And then you get a couple constraints that say, how do you balance these other competing interests off? And when I say competing, they're not fighting with it, but there are things you need to consider. One of those is the privacy issue, which gets into things like HIPAA and things like that. You have to clearly respect individual privacy. You're going to have some challenges on the proprietary side, but again, hopefully there's a strong interest in saying data sharing has real value to public health, but you have to recognize that. And the last one is just IT systems. It's one of those things. I'm an old techie, I'm an IT guy, but I can tell you, you got to really think about what you're doing before you dive into an IT system. And that's some of the commentary I gave to the federal government before they had some IT issues in the past. So you need to think through those. So those are the considerations, I would say, that you need to take into account when you look at these kind of issues. But the use of data can be really important to making informed, better decisions on these issues. And so that's something that I think, again, the general direction, I want to move in that direction.
Good morning. I'm Johnny Vanderhoof from the Michigan Association of Nurse Anesthetists. As you pursue increasing the access to care to the citizens, do you see an increased value of utilizing advanced practice nurses such as certified nurse anesthetists and nurse practitioners and increasing that access?
Yeah, I appreciate your question. I actually guessed that was probably the question when I heard where you're from. That's something we're looking at. There's already some legislation going on. There was in the last session on this topic. We're doing a lot of homework and research on that. I've actually asked Nick and Chris, we're doing a lot of review of the whole public health code. But how can we find more opportunities to be innovative and be proactive on issues like that? So generally, I'm in favor of looking at that topic to see what we can do to say how can we provide better quality care and at a more affordable price to more people. The details are the problem about getting people to work together. But conceptually, I'm with you on the direction.
Question over here.
Hi, my name is Mark Cohen. I'm with Blue Cross, and I'm also a recent Achilles repair survivor, too. But my question was more from a global perspective. You know, running a state like Michigan, last year, our neighbors to the south had an issue with their drinking water, you know, the effluent from the runoff from agriculture caused the water to be undrinkable. And, you know, we have a lot of interest from out of state coming in that want to do deep well, horizontal hydraulic fracking with all kinds of contaminants. So my question is, how are you addressing the role of the environment for our health as Michigan citizens?
Sure, that's a great question, and I'm proud of our track record here. And actually, the example of the algae bloom is a great illustration of where Michigan is actually being forward-looking. When the algae bloom happened, which is a terrible thing, and you look at what the causes were and the consequences, and you compare Michigan's practices to Ohio's practices, we have done historically much better in terms of looking at the use of fertilizers, agricultural practices, industrial practices than Ohio. And actually, Ohio is trying to catch up with us, which generally I like to see happen. So we've been very advanced there, but what I would say is we're not staying still with even where we're at. The question is we're continuing to work hard to raise our standards, and how we do it in a thoughtful, collaborative fashion, though, with all sectors so we can, again, be more environmentally sound. Same thing on fracking is a good illustration. There are states that messed up how they do fracking, to be blunt, and that's drawn a lot of attention to fracking. A lot of people don't know in Michigan, we've successfully fracked over 10,000 wells in the state of Michigan. Most people have no clue. And so we've got a record that's really strong. We've never had a problem with respect to within a well or a major problem in our state with respect to fracking, but that wasn't good enough. So when I did a recent message on energy and the environment, we actually commissioned the University of Michigan's Graham Sustainability Institute to say they're going deeper with wells, they're going more horizontal. So could you help come up with information that then we can do greater rulemaking that's appropriate, that we can work together on with everyone to make sure we're doing new ways of fracking right? So actually, we recently issued new rules on fracking that ask for more information on better benchmarking, on better chemical information, on a number of these things to show that we're a leader in this. So there's a whole number of areas like that. Then you even get to the issues of lead and the old lead paint kind of issues. So we're trying to be proactive, working with groups to say how we can do well in terms of kind of environmental health.
No question here. Here and then here.
Okay, yeah. Hi. Dave Billardello with Priority Health. Hi. Is there any connection between healthcare and this ballot initiative I've been hearing about?
Well, I appreciate that. Boy. Thank you for that question. Well, there is, in the context that we need safer roads in Michigan. And that is a health issue. That, in fact, if you think about it, and you're driving around on the roads, and you hit a pothole, and you're going to lose control of your vehicle to some degree when you hit that pothole. That's a condition that puts you at risk for an accident. If you swerve to miss a pothole, you're a distracted driver. You're at risk, and other people on the road are at risk. And again, that can lead to accidents and death and injury. If you're driving around Michigan's roads, in southeastern Michigan, look up underneath the bridge. 14% of the bridges have plywood or steel mesh underneath to keep falling concrete from falling on your vehicle. That's a major safety risk that we're trying to moderate, but it's not a good answer. So we really do need additional resources, and $1.2 billion, which is what this proposal would raise, would get us on a path to having much better and safer roads in Michigan. And to give you another benchmark, Ohio spends $1 billion more than we do. And I don't know how often I get the comment of people saying, well, I know when I cross the state line. And you wonder why. It's simple. We have great practices. We do good work here. But we're $1 billion shorter than they are in what we invest in our roads. So May 5th, there's a good opportunity for you to do something about that. So thank you for that kind question.
We have time for one more question. Oh, I'm sorry. I think he was, yeah.
The gentleman's hand was first.
First of all, thanks for all the hard work that you've put forth for the last 4+ years. I commend you for all of that. Having said that, my name is Chuck Marlin. I'm the mHealth Chair for the Mobile Technology Association of Michigan. The reason I say that and bring that out is that we as an organization here looking to advocate and promote the interest of healthcare through mobile technology are always striving to try and get people to work together. One of the things that happens on a national level, which is likewise true in the state of Michigan, is that standards and things that people understand have to be met and they have to be adhered to, but they have to be first formed and put together. We don't have any sort of standardization coming across all the lines of mobile technology and healthcare in Michigan. Is there anything that the state may consider doing or has done that we're not aware of that could help collaborators and all of those people come together to advance the interest of mobile technology in healthcare?
Yeah, that's a good question. I haven't been asked that before, so I'd be happy to have our team follow up with you. So if you have ideas and thoughts, again, the balancing act I have there is I don't like to mandate things, but if there's a way we can help be a clearinghouse, a coordination function to get people talking, and you can help identify those things. Again, tech area I love working in, and it's something that mobile apps are something that's really exciting to see. I mean, I was a big one of those device ones, and I don't want to overmarket one device, but I had that I only recently retired while I was on scooter. Because it was too depressing to see have your number come up and say you had about 8 steps for a day. So now that I'm out of my scooter, I'm actually recharging my battery so I can go. But many of these applications are really cool. And one I'll share is the mobile stuff is not only for healthcare because it's fun. I mean, how many people do you end up competing against? Which actually makes us all healthier. When you have one of those, you'll be comparing steps with a few friends. Is that now I have an energy application on my phone, so now I can go see energy app use in my house, and so I'm driving my family nuts there. It doesn't tell the particular device, but I can say, someone's overusing energy right now, knock it off. So again, those are kind of the neat things for the future that can make us healthier, so I appreciate that.
Governor, any last comments for us before we adjourn today?
Yeah, well, Hank, I want to thank the Detroit Regional Chamber for having a conference like this. I think it's really important to gather people together because this is what we're talking about best practice, sharing information, sharing ideas, both within the borders of Michigan and from outside of Michigan, on what we can learn to do better to be successful. And the main thing is we do it in the context of how we can work together to solve these problems together. just like I said, let's look at root causes. Let's look at really measuring success. Let's do it as a community. And that really creates a format for great success. And think about how far we've come in Michigan in just the last few years. I'm really excited about the future, though. This whole river concept, I'm really fired up for that because I believe it's the future of the public sector, and it's a better way for us all to work together. So thanks for the opportunity to be here today, and have a great session.
Well, Governor, thank you. You've been a great chamber, a partner of the chamber, and obviously a great leader for the state of Michigan. So thank you for being here.
Thank you.